Busitama University is one of the public universities in Uganda, which started way back in 2007. It is located in eastern Uganda. Globally, over 85 million people have been infected by HIV/AIDS, out of which 40 million people have so far died from AIDS-related death. Currently, 39 million people are believed to be living with HIV/AIDS, out of which 30 million are on highly active antiretroviral therapy. The vast majority of the 39 million people living with HIV/AIDS are living in sub-Saharan Africa, where over 25 million people are in sub-Saharan Africa. That translates to about 68% of global HIV infections. Current drugs, HIV drugs, cannot cure HIV because of HIV latency. In Uganda, currently 1.4 million people are believed to be living with HIV/AIDS, out of which 1.2 are on treatment. Now, since the introduction of the highly active antiretroviral therapy in the mid-1990s, HIV patients live longer, productive lives because highly active antiretroviral therapy is able to restore the immune functions so patients can live healthy and longer. However, highly active antiretroviral therapy, or HAT, has limitations. First of all, it has adverse side effects where many patients abandon treatment. And in addition, the HAT is toxic to body cells. And also it has other complications, such as dyslipidemia, which is associated with some regimens in HAT, such as protease inhibitors. And this can lead to increased risk for heart attack and stroke. So there is need to develop a cure for HIV/AIDS. Compounds in Provirid will be able to coerce to wake HIV from sleep, because a small proportion of resting memory CD4 cells are latently infected by HIV, whereby they contain the HIV DNA known as the provirus. So current drugs cannot target provirus, and therefore there is no cure. But compounds or phytochemicals in Provirid will be able to coerce and reactivate the HIV which is sleeping in resting memory CD4 cells. And when used in combination with HAT, the HAT will suppress the rebound in viremia, so that the cells that have been reactivated, which are latently infected by HIV and reactivated, will be cleared by the cytotoxic CD4 cells. And we believe that over time, this can result in the clearance of the latently infected reservoir of HIV, with the result that it can be curative. The name Provirid came about because HIV is incurable because of a small proportion of resting memory CD4 cells contain HIV DNA known as provirus. So the name Provirid is derived from the word provirus. To get rid, this product should rid the body of the provirus, hence the name Provirid. We want to develop herbal remedy for management of HIV/AIDS infection with a goal of developing a cure to HIV/AIDS. We're using herbal remedy because these plants contain latency reversing agents. This is a prototype of Provirid, which is developed or formulated from medicinal plants that are used by herbalists in eastern Uganda to treat people living with HIV/AIDS. So preliminary phytochemical analysis indicate that these plants, which are used to formulate Provirid, contain phytochemicals that can reverse HIV latency. So we want to develop herbal remedy that contains phytochemicals that can reverse HIV latency, such as prostatin or other analogs of prostatin, including ingenol or prosinidine. And then we want to test them. So we are using herbal remedy. Why? Because they contain phytochemicals that can reverse HIV latency, including prostatin.